Today we are going to be reviewing the argon plasma coagulation APC equipment usage. So the APC uses a jet of ionized argon gas plasma that is directed through a probe. The probe is placed at some distance from a target area, and argon gas is emitted, resulting in coagulation of a bleeding site or destruction of tissue on the other end of the jet. The depth of coagulation is usually only a few milliliters, and therefore safe to use in areas of GI tract with thin walls. Reasons we would be using this is colon polyps after a polypectomy, esophageal cancer, esophageal gastric and intestinal varices, hematosis of all sources of bleedings like tumors, radiation proctitis, watermelon stomach, AVMs, and tissue devitalization to diminish or destroy tumors. Okay, so equipment we would need is we would need the Irby machine. Now in our department we have Irby in pod A and pod B. The one in the ERCP room does not have argon in it, so that would not be able to be used with a argon plasma coagulation. So we would grab the Irby from pod A or pod B. You would need a grounding pad. You also need a grounding interference cord that should be attached to the Irby machine, but make sure it is there. Side note, anybody that has a ICD, a cardiac defibrillator, you will need to follow the department guidelines about putting a magnet to deactivate the ICD prior to cauterization. So please follow your department's protocol on that. You also will need a straight or a circumferential fire probe. They should hopefully be located in the basket next to the Irby. Okay, now we are ready to plug in the machine and turn it on. Okay, we want to place the foot pedal at the doctor's feet, and we will attach the grounding pad to the patient. And when you plug it in, the light should turn green, indicating good patient contact. We want to attach the black grounding cord to the exposed silver knob on the scope. Okay. All right. The doctor will tell you to select the APC program from the list. There are various choices there. We've got right colons, colon, rectum, stomach, there's esophagus, and they're just going to tell you which one to select. After you select, then you want to make sure you attach the straight or the circumferential probe, whichever one the doctor would like you to use, into the Irby. Have plugged in the probe, then you can press the highlighted green focus button next to the probe. That will show you the standard settings that we would use for this case, an APC right colon. Now it is up to the doctor's discretion. They may want to adjust those settings. If so, you can press the arrow next to the watts, and then you've got those arrows off to the right that you can increase or decrease, and then just go back and return. But this is usually the typical setting. Okay, then the doctor will ask you to purge the device. There's a little button next to the green highlighted. You will press that, and then the doctor will be ready to receive the probe. You will hand it to the doctor, and the doctor will put the probe down the scope until it is visible. After the scope is visible inside the patient, the doctor will want you to purge the device. This ensures the device is filled with argon gas. Passing the device down the scope displaces some of that gas. Again, verbally confirm your settings are correct, and then the doctor will administer the APC using the foot pedal. And We'll complete the procedure. Once the procedure is done, you want to make sure you document in the Epic. You want to document the IRBI number, the IRBI settings, the grounding pad where it was placed and that it was removed safely. And then you have completed this procedure with argon plasma. These steps will be located on the Work 360, so you can review at your convenience, or if you want to have assistance and hands-on, you can ask a fellow coworker to work through this with you as well.